What are the neurological sequelae of TB meningitis? Imagine a serious infection that not only affects the lining of the brain and spinal cord but can also leave lasting marks on how the brain functions. That's what happens with tuberculous meningitis, a severe form of tuberculosis that targets the central nervous system. When Mycobacterium tuberculosis infects the meninges, it triggers inflammation, which can cause a variety of neurological problems that may persist even after the infection is treated. One common complication involves cranial nerve palsies. Because the inflammation tends to gather at the base of the brain, it can encase the nerves that control facial movements, vision, hearing, and swallowing. This can lead to weakness in facial muscles, vision disturbances, hearing loss, or difficulty swallowing, depending on which nerves are affected. Another serious issue is stroke, or cerebral infarction. The inflammation can damage blood vessels in the brain, especially arteries at the base of the skull. This vasculitis can cause narrowing or blockage of these arteries, leading to strokes. These strokes often involve deep brain structures like the basal ganglia and thalamus, resulting in weakness on one side of the body, sensory problems, or even cognitive difficulties. Hydrocephalus is also a frequent complication. The inflammation and the resulting exudates can block the normal flow of cerebrospinal fluid, leading to its buildup inside the brain's ventricles. This increased pressure can cause headaches, vomiting, confusion, and in severe cases, long-term brain damage or motor problems. Hydrocephalus can be either communicating, where the fluid absorption is impaired, or non-communicating, where there is a physical blockage. Granulomatous lesions called tuberculomas can form as the immune system tries to contain the infection. These nodules appear as ring-enhancing lesions on brain scans and can cause seizures, localized neurological deficits, or increased intracranial pressure, depending on their size and location. Inflammation can also affect the membranes surrounding the spinal cord, leading to arachnoiditis. This causes nerve roots to stick together and can result in nerve damage, weakness, sensory changes, or even paralysis of the limbs. Bladder and bowel control issues may also develop if the spinal cord is involved. Long-term effects are common among survivors. Many experience ongoing cognitive problems, memory issues, motor weakness, or even epilepsy. These arise from the combined damage caused by strokes, hydrocephalus, and direct injury to brain tissue. In summary, the neurological aftermath of tuberculous meningitis can be quite complex. It often involves nerve damage, strokes, fluid buildup, and granulomatous lesions, all of which can lead to lasting disabilities. Early diagnosis and prompt treatment are crucial to minimize these long-term effects. If you or someone you know is dealing with this condition, it's essential to consult healthcare professionals for personalized care and management.